welcome to today's podcast. Today I'm joined by Louise Brady, who is the primary care nurse lead at NHS England. Welcome, Louise.
Afternoon, Linda, and thank you so much for the invitation to speak on your podcast.
Well, these are a series of podcasts where people who are looking to be leaders in the NHS can listen to those of us who've been through the process for some time. So it would be lovely if you could start off by telling us a little bit about your career pathway so far.
Oh, my goodness me. Well, obviously, I've been a registered nurse for 25 years. I think the ambition as a young teenager was to be a star of stage and screen in the arts, but I had size 9 feet and was far too clumsy, and realised I was actually quite good with working with people and communities, so decided to become a registered nurse. So I started my journey in the 90s and did a couple of years within the acute sector, medical, surgical and A&E rotation. And as a youngster, worked in a local chemist shop as a Saturday girl, so I'm sure I may age there. But really got to meet people and communities where they're at, and that's kind of where I started. And from there, I got an opportunity to work in community nursing under a district nursing team as one of their community matrons. And I think that's where I fell in love with primary care and community nurses and thought this is where I need to be, because I used to be reprimanded on the wards consistently for spending too much time talking to patients when there was far more to do in the sleuth room.
Brilliant. And you've progressed massively since then to now be the lead of primary care in NHS England.
Well, it's been a bit of a baptism of fire and a bumpy journey across those many years, with some fantastic memories and some great role models and mentors, Linda, along the way.
Yeah, I think people forget that there are some amazing people that we meet that help us along the way. We never really do it entirely on our own, do we?
Absolutely. Yeah.
So how would you actually describe your leadership style?
Oh, that's a tricky question. I think facilitative and collaborative. And sometimes, even to this day, when people talk about leadership, it often feels quite a difficult and a nebulous term, specifically in, with frontline general practice nurses. And I think, it isn't about command and control, it's about climate control. So it's how can we have a positive and make a positive impact on the lives of others, and how can we encourage people to thrive in that climate and not just survive. So I think that's one of the essences of good leadership for me as an individual.
Yes, and I think that is so important, isn't it? I think the days of command and control are in the past now, although I think sometimes there are still people that think that's the best way forward. So what have been some of your standout defining moments, would you say, and what have they given you that have helped you move further forward?
I think I always start from my strengths, and my strengths, I think, are working in partnership with patients, families and carers. And throughout my clinical and now my strategic career, those patient voices have been my eyes, ears and moral compass, really. And working with them within communities has been absolutely amazing. So an example of that would be, I never thought, even a few years ago, I would have the confidence to sing and dance with patients at an international music venue at Bridgewater Hall in Greater Manchester. And we did that, to raise awareness of the power of nurse and carer partnerships. So that was certainly a standout moment. And I think from a clinical point of view, as primary care nurses, we make a significant impact day in, day out. into the lives of people and families. And I've worked extremely hard over the years to create better access and better continuity for patients. So one way that we've achieved that, particularly in the north, is by supporting groups of patients with long-term conditions. So we've created that time and that headspace for our nurses to work and deliver quality outcomes and cares. And outcomes really do matter.
They do, and I know that you still spend some of your time in practice, which is, keeps you real, I'm sure. But one of the things that I find fascinating, and it might be worth exploring this for a few minutes, is how do you, as a practicing clinician, help people share their stories with you when many, particularly older people, still come to see a nurse or a doctor as the expert. So there's that kind of prestige suggestibility. So they won't question necessarily what it is you're saying to them. How do you help them overcome that?
I think it's kind of how we step back. So we let our patient educators and our activated patients step forward. And to do that, it is about deep listening and active listening. And that's, as we know, far more than a valuable social habit. And that can be really challenging to do in time-pressured clinics and consultations. And that's why working with small teams of nurses and small teams of groups of individuals gives that time and creates that capacity, so people really feel that they've been listened to and that they are leading, the important stuff, about their health, their mental health, their well-being. And if we let our patients and our carers, take charge, and we come alongside them in the context of that journey, I think that makes really great art and science for nurses.
No, I totally agree. I think it's really, really powerful. So what have been some of the key lessons that you've learned along the way?
Oh my goodness. I think be yourself, really, really important. Bring some of you into the workspace, be professional, be passionate about what you do, and don't give up. I've failed many, many times during my career. And so you have to have a consistency and a passion and a persistence really for excellence. Because that's what we'd want for our own loved ones and families. So I think that has to be a key message. And, vulnerability is important as well. So if you are struggling and you need support and advice from your mentors, shout help. That's really important. And often as nurses, we want to carry on and do the very best we can in whatever role we undertake. And sometimes we have to take a step back and think, actually, I'm really struggling. I could do with some additional support. And sometimes that's really difficult to ask for.
Yeah, but there's huge power in that, isn't there, when you do?
Absolutely, yeah.
So it'd be quite interesting to just unpick a little bit about how you've used those opportunities of failure to help you grow rather than seeing it as a negative step backwards.
Yeah, I mean, my granny, God rest her soul, used to say, "What's for you won't go by you." And I'm sure many of us have heard that phrase before. And I think, that there's an element and grain of truth in that I think we work incredibly hard as nurses and we want to achieve the best we can, whether that's in our clinical practice, whether it's in an academic sense. And sometimes, life gets in the way. And I think it's just about that reflective piece of work and about trying to achieve that work-life balance that we're all striving for. And I think it's just realising that if you've given 110% and you've given the best that you possibly can to your role, then you've nothing to worry about or negate yourself about. And I think it's just having that sort of growth mindset that, okay, this opportunity didn't come along, it didn't transpire, but perhaps the next one will. And I think that's a really positive and healthy attitude to have.
And they're there to teach us something, aren't they? I mean, they happen for a reason. And
Yeah.
if we can take the learning from that, like you've been doing, I think it really helps us to grow stronger and to build that resilience that we need, particularly if you're in a clinical role.
Yes, absolutely.
So, what would you say your biggest learning has been?
I think the role at NHS England is a fantastic job. So obviously I support, mentor, do some clinical shadowing with nurses across England. And I see the incredible breadth and depth of clinical acumen, I like to call it, and the impact that they have in their communities. And I think some of the challenges around that are that we really need to value the work that our primary and community nurses do.
That's great. And I'm sure you've been a great inspiration to a number of people and will continue to be. But who's inspired you? Who's kind of helped light the fire inside of you over your career
Oh,
so
there are
far?
so many individuals, both in and outside of nursing. I could mention just a few. So Helen Barlow was my director of nursing at Greater Manchester for a few years, and she was an amazing leader because she gave you permission and the green light. And she said, if you can bring the evidence, you can show me the outcomes, go and do, Louise, what you need to do. Be innovative. Use that creative ingenuity that you have. Use your arts, use your science. And she was amazing. And she gave me a real opportunity to flourish and grow as an individual. Then obviously there's patient and peer leaders like Trevor Clower and Mike Thorpe, who are wonderful in their different areas of carers and cancer care. And then there are individuals that work in specific areas like John Walsh, who is a fantastic leader and manager, and has supported homeless health and inclusion work and really tackled health inequalities by restoring relationships with nurses, midwives, healthcare assistants across the system. And he's a real inspiration to me as an individual.
So what are what's the common qualities of those people that have inspired you, do you think?
I think there's an authenticity, a veracity, and ultimately a trust there. Because the people that inspire me are not afraid to form genuine partnerships and explore professional relationships, both with different members of the teams and the workforces. And, they are real cheerleaders and supporters for other people. So they want other people to grow and develop. And that's what makes them inspirational. And they have consistency. So they don't come and do that for a few months and then disappear. They keep up the great work they're doing throughout their careers.
There's two words that you've used throughout the last few minutes that we've been talking. One is basically authenticity, and the other is trust. A lot of people who come on the leadership courses that we run will often say, "So how do I maintain my authenticity, and how do I trust people?" Well, what are your thoughts on that?
Yeah, I do think you have to. Time is one of the most important currencies in healthcare and social care, and we need that time to be able to understand each other, which sounds extremely obvious. But in busy, hectic healthcare environments, that does not materialise easily. And so things like going to the local coffee shop, perhaps in your lunchtime, or agreeing with your local general practice nurse or PCN lead, actually, could we meet for cake and coffee? Could we just have a little bit of time outside of the work environment just to get to know each other, and what makes you sing, what helps you to do your job? Those are really critical foundation blocks to building trust amongst individuals and teams. And I think I'd like to see a better focus, a more critical focus on that kind of culture and team morale within the NHS and social care.
That's great. So we've got some echo on the line. Let me pause a minute, somebody. Okay, that sounds better. So do you think squeaking? Okay, can you see the echo?
No.
Oh, how strange.
Oh.
Okay, let's continue and see what happens. So what do you think the qualities of women leaders are as opposed to men?
Oh, another complex question there, Linda. So I think, I mean, if you looked at some of the literature and you looked into, you know, how our brains develop, there are different sort of theories around the differences, the intrinsic differences between men and women. But for me, I've had some fantastic leaders who have been both male and female. And I think it is about values. It is about how you manage relationships ultimately. And it's about working together. So although there are differences, there are strengths in diversity within those teams. And it's good to have a good mix of people from all backgrounds and walks of life. But I do think it comes down to your values. Do your values align? Are your goals the same? What can you do together? Two heads are better than one, aren't they?
Yeah, absolutely. So can you tell us about a difficult decision you had to make at work and how you navigated your way through that?
Oh, gosh. I might give you a clinical example, actually, since I've been in this role as a primary care nursing lead. So I pride myself on being able to support frontline full-time nurses. So I like to put boots on the proverbial ground. And I was asked by one nurse to come in and oversee, shall we say, her respiratory clinic. And this particular day, I went in, introduced myself. She was quite a newly qualified nurse, and she was obviously lacking in both experience and confidence. And I said, and where are the patients? And she said, oh, well, actually, Louise, we have to review our patients by telephone. And so there isn't anybody coming in to the practice today to see me in a face-to-face capacity. And I was quite incredibly shocked by this protocol that the practice team had brought in. And she was visibly upset because care was being left undone. And we know, don't we, from the recent landmark reports around respiratory and asthma and COPD, how incredibly important it is to be able to clinically assess people's colour, how they use their inhalers, talk about shared decision and give that holistic personalised care. So it's my role to support newly qualified nurses, and I was able to challenge that with a practice manager and a GP partner. And I have to say they were incredibly gracious and took on board, you know, the learning opportunities from that particular day. So I think people may not feel that I make an awful lot of change, but I do. I know I do, and I know I'm able to advocate on behalf of those that may not have the expertise and the confidence.
Yes, absolutely. And making small changes they accumulate, don't they, to make quite considerable changes?
Yes.
Absolutely. So what's the most difficult thing you've had to do in your career?
I think there's been many challenges, many challenges. And I think this has to be my biggest challenge today, is working with the national team, because there are so many people to connect with. and so many different directorates within NHS England. And it is about interprofessional, interdisciplinary learning, and we all need to understand each other's roles and how we can work together. So I think working in a big organisation is one of the most challenging things to have to do. You know, and my ethos is that I need to connect more and correct less. And it's sometimes, as nurses, we want to jump forward and challenge ferociously. And we have to understand everybody's priorities and try and work with people. And being a very, very large organisation, you know, I think I'm succeeding in many areas, but I've got a long way to go.
Always something else to go for.
Yeah.
So what brings you the most joy?
Oh, wow. On a personal level, it has to be time with friends and family, music. I absolutely love music, and I like walking my dog. And I think that helps me and nurtures me and sustains me through difficult times.
And at work, what brings you joy?
Oh, working with all our nurses and our patients. You know, particularly brilliant nurses like Julie Roy, who's our general practice nurse and nurse of the year. She brings passion and she brings inspiration, and she recently read a poem out at one of our nursing conferences, which was absolutely amazing. Maya Angelou, and just talking about how, you know, what leadership means to her, and yeah. So when I see nurses use all their strengths within their field of nursing, so that's all the evidence-based stuff, all the research, all the literature, and they bring a part of themselves to the role, I think that really inspires me.
Brilliant, brilliant. So how do you maintain balance in your life? You've got a busy life, you're working at NHS England, you're keeping your feet on the ground in practice. How do you maintain balance?
Yeah, I must admit, I do find that a challenge. And I know I have to turn off the computer and the emails and not be tempted to, you know, look at that, particularly on a weekend. I think I've got better at pacing myself as I've got older. You have to do, don't you? Because and I do need to have a focus on my own health and that of my family. But as I say, I do love nature. I listen to music. I do enjoy listening to podcasts as well, reading, and the occasional singing in a local singing group.
That sounds amazing. So what would you like to be remembered for in your career?
Well, outcomes matter. Outcomes do matter, but I think I'd like to be remembered for good deeds and actions. And supporting, caring and listening with others. I think that would be a great legacy to be remembered for.
No, wonderful, wonderful. And finally, what would your key piece of advice be to somebody who's embarking on a new career in the NHS?
It can feel daunting. Don't be discouraged. Don't be discouraged. Don't give up. Be yourself. Be confident, because you can do it. And always, always, there's somebody there to help you. So reach out and speak to a trusted individual, a mentor, or somebody that you can have one of those critical conversations with. Be curious as well, because there's lots of things that you can do in your career, and be brave and be bold.
Bold and brave. Brilliant. Absolutely brilliant. Thank you so much, Louise. That has been an absolute pleasure today.